And welcome to Hartford Hospital's live Facebook chat. I am Hartford Healthcare's Tina Verona. If you just saw Wendy Nichols live on WFSB Channel 3, or maybe you just logged into the Hartford Hospital Facebook page, we thank you for joining us, and we encourage you to ask Wendy a question. Wendy Nichols, of course, is a physical therapist at the Center for Musculoskeletal Health at the Bone and Joint Institute at Hartford Hospital. Wendy, thank you for continuing the conversation on Facebook.
Thank you for having me.
So tell us, to those who have just logged in and maybe didn't see your interview, tell us about the Center for Musculoskeletal Health.
Well, at the center, we treat everyone from athletes to people with arthritis. It's a different approach where we treat the person as a whole and not just their injury. So a person will come in, they'll get a full assessment, which will help us to individualize their program for them. If they're a smoker, we can help them stop smoking. If they need to see nutritionists, we can set that up. Or if they prefer a more holistic approach to treatment, we can get them in touch with our integrative medicine team.
Now, there is some impressive state-of-the-art technology at the Musculoskeletal Health Institute. Everything from the anti-gravity treadmill to a motion lab, things that you would find in an Olympic training center. First, let's start with the anti-gravity treadmill and what that can do. It's almost like walking on the moon, I've heard.
It absolutely is. It takes some of your weight off of you, so you feel like there's no gravity. We can go up to 20% of your body weight. So when you're running on the treadmill, it's almost like it's hard for you to get back down onto the treadmill sometimes, depending on how far we go with the weight limit elimination.
Now this is good for training someone who is running, but also somebody in rehab who's maybe just had surgery and needs the exercise and can't actually put all of their weight on a joint.
Yes. So typically, after a total joint replacement, let's say you have discomfort, you have pain, getting them on the anti-gravity treadmill allows us to see how they're walking and start to teach them the correct way to walk a lot earlier than if you're on land.
And for the athlete, let's say for a runner, it would help with them improve maybe their speed and their time?
Yes, as well as the cardiovascular system too. When we decrease the amount of weight that you have on your joints, we have to actually increase the speed that you're running at to get you to the same cardiovascular fitness.
We are talking with Wendy Nichols. She's a physical therapist at the Bone and Joint Institute at Hartford Hospital. Specifically, she leads the Center for Musculoskeletal Health. So we encourage you to ask Wendy a question about fitness goals if you're a runner, if you're a swimmer, or perhaps maybe you've just had knee surgery and you have a question about rehabilitation or recovery. She's here to answer your questions, so please feel free to ask Wendy a question. Let's go into the motion lab. Now this is pretty cool. This is an area where there's cameras all around and you can sort of evaluate a swimmer or evaluate a runner and look at their motion, things that they might be doing wrong. Tell us about that.
Yeah, so what we do is when you get into the motion lab, we'll put some markers on your body and have you do the sport or the activity that we're going to be looking at. And from the cameras, we can slow the motion down so that we can really take an in-depth look as to what is going on when you're doing that. So it helps us to assess any injury that you may have if you continue doing the motion that you're doing, if it's incorrect.
Yeah, and that's for all athletes now. That's for swimmers, people. You can analyze golf swings, baseball swings, anything, right?
Right, any motion, we can analyze that.
And so you'll record it, play it back, and if somebody's overcorrecting themselves or if they're doing something wrong, maybe they've made a bad habit that they've done, you can help them with that lifestyle modification and prevent future injuries.
Right, we can see if there's weakness of a specific muscle, if a joint's not moving the way it's supposed to, and then we can come up with a corrective plan for that.
Okay, we have a question from Rick Johnson. He says, I am experiencing pain in my elbow on the medial side of the joint, point tenderness, and it hurts more when putting pressure on it as well as when trying to twist off large caps from jars, etc.
Okay, so the medial side of the elbow, that's probably more what we call golfer's elbow, where typically if you're a golfer, you get this injury. That sounds like what it could be, but I would highly recommend that's something that we do treat at the Center for Musculoskeletal Health.
So Rick may be a golfer, and Rick may be interested in the open house that we're having coming up on March 7th, inviting folks to come in and look at the facility and tell us a little bit about that.
Yeah, so March 7th at 5 p.m., we're going to be doing an open house where the community is able to come in and take a look at what we have to offer. So it's more of an up-close and personal event where you can talk to the fitness specialist. You can try the anti-gravity treadmill, take a look at the motion lab, see what we're actually offering at the center, and then see if that's something that you're interested in doing.
And we encourage you to join. There are only a limited number of spots, 20 to be
20.
exact. So if you call 1-855-HHC here to register for that open house, we do have a limited number of availability for that. And because we have physical therapists there, you do want to get sort of a one-on-one almost consultation.
Yes, there's
right?
going to be more one-on-one where you get to actually talk to the staff that's there.
So we encourage that. Let's talk a little bit about training now. Now, let's say you're an athlete. Let's say you're a runner or you're a swimmer, and we're going to be getting into the spring and summer months. So a lot of marathons will be happening, triathlons will be occurring. People are starting to train now. And the Musculoskeletal Health Institute at the Bone and Joint Institute can actually help in that training. And if you're a seasoned runner, maybe start 12 weeks out. Talk to us about the training and what's involved, how you can help an athlete.
So typically, if you're able to run 3 miles and you're training for a half marathon, it's usually about a 12-week program. So what we can do is actually get you onto the anti-gravity treadmill, take some of the weight off of the joints, increase the speed so you get the same cardiovascular work that you would if you were running on land.
So, and this is a 12-week course, right? And that's for if, let's say, you've been a runner for some time, not for a beginner.
Right, yes.
Like myself. So a beginner would be more like, what, 16 months? Or
usually probably around 16 weeks or so.
And you do recommend, if somebody's coming in, obviously to have that consultation so you can go over all the pertinent questions and see exactly how much time they would take for training and what might be the training steps for them, correct?
Correct. So we'll have someone come in, we'll orient them to the equipment, do an assessment to see if there's anything that we need to work on with them, whether it's some strengthening, some stretching before they start their program.
And you almost take it full circle, too, at the Center for Musculoskeletal Health, because it's not just about rehab, it's not just about fitness training, but there's also an intricate part of that piece, which is integrative medicine,
Correct.
Which plays a really important role. So tell us how that weaves into this.
So integrative medicine, they use different modalities such as acupuncture or massage. So if you're training for an event and you're overusing and you're doing a lot of work on those muscles, the massage and the acupuncture can really help with releasing the soft tissues and keeping you flexible.
In a natural way, which is nice.
Exactly.
A natural, holistic
A very
way.
holistic approach, yeah.
For sure. So we're talking with Wendy Nichols. She's a physical therapist, of course, at the Center for Musculoskeletal Health and area director at the Bone and Joint Institute at Hartford Hospital. We encourage you to ask her a question. She's here now. She can answer anything about fitness, about the Bone and Joint Institute, and all the state-of-the-art, really cool technology that we have there as well. There's also, in the other part, there's regular treadmills. There's also other things that you would see in a gym, right?
Yes, there
that we
absolutely.
offer.
Yep, so we have rowers and we have regular treadmills, we have bikes, spin bikes, we have spin bikes too.
And the anti-gravity treadmill, back to that because that's really, really incredible, I think. That's only in elite training centers, or somebody like Tom Brady would use something like that, right?
Yes,
to have it here is a big deal.
Yes, they have it all the NFL teams actually have them. So it does help get people back quicker. So that's why a lot of the sports teams have them.
Yeah, so we're lucky to have something like this, obviously, here in Hartford. So we encourage folks to come to that open house. Again, that's March 7th. At 5 p.m., Wendy will be there along with other physical therapists. We encourage you to sign up and register, to go to 1-855-HHC here. Again, that's March 7th at 5 p.m. There are a limited number of seats, only 20 seats, so we encourage you to join and register and come check it out. Come check out the facility and everything that it has to offer. Well, we thank you for joining us for our Facebook Live session. I'm Hartford Healthcare's Tina Barona. Thanks, and we'll see you soon.